depending on where you are joining us from. And welcome to this press briefing of the Africa Centers for Disease Control and Prevention, coming to you from the headquarters of the African Union in Addis Ababa. My name is Wayne Musabayana, and it's an honor to be your moderator today. Now, this is a bit of a bittersweet session that we're having today. It's one of those moments when one experiences joy and sadness at the same time, because this will be the last time that Dr. John Nkenga Song will be sitting next to me presenting to you the situation of COVID-19 on the African continent. I think we've been doing this for more than 2 years now, and it had become a habit every Thursday that we would meet here, but today is the day when we part our ways. I'm sure he will explain more details in that regard. Before we get to that, however, he's going to go through the usual report on COVID-19, as well as the vaccination and other interventions regarding COVID-19. And then after that, we will then go into our question and answer section. And I just want to repeat, or rather to give you that WhatsApp number again. It is +251 94 550 2310. Let me give it to you again. It is +251 94 550 2310. Alternatively, you can come through live or send your questions through the question and answer platform. All right, it's now time for me to hand over the floor to Dr. John one last time for the briefing for today. Dr. John.
Thank you, Wayne, and good afternoon, everyone, and welcome to this platform. As always, I would give you an update of the situation of the COVID-19 pandemic on the continent, and then, of course, discuss the vaccine and vaccination situation. So let's begin with the epidemiological situation. As of today, May 12, 11.5 million COVID-19 cases have been reported across all member states on the continent. Of that number, 252,000 deaths have occurred. As a continent, we are facing the fifth wave with 12 countries, and because there are just 12, I'll name them: Algeria, Benin, Congo Republic, Egypt, Guinea-Bissau, Kenya, Mauritius, Somalia, South Africa, Tunisia, Zambia, and Zimbabwe are all going through the fifth wave now. So it looks like we have enjoyed that period of downward trend, and now we are beginning to see how the countries report ticking up of the virus. 48 countries have reported the Omicron variant B11529, and 16 of them have reported the Omicron BA2 sublineage. And these countries include Algeria, Botswana, DR Congo, Ethiopia, Kenya, Malawi, Mauritius, Mozambique, Namibia, Nigeria, Rwanda, Senegal, South Africa, South Sudan, Tunisia, and Zambia. If we now look at the trends from last week and this week, a total of 49,000 new cases were reported, and this represents a 32% increase in the number of new cases. In terms of that, the continent reported 195 new cases of deaths, and that represents about a 119% increase compared to last week. If we now compare the 4 weeks trends, we notice that an average of 25% increase in the number of new cases have occurred over the last 4 weeks. And similarly, a 7% average increase in new deaths have also been reported. And the countries that amongst our most populous countries on the continent, South Africa is reporting 57% average increase, DRC 17% average increase, Kenya 8% average increase, Egypt 82% average decrease, Nigeria 16% average decrease, and Ethiopia 8% average decrease. In terms of testing, as a continent, 106 million tests have been conducted since the start of this pandemic. And last week alone, 506,000 new tests were conducted. And that represents a 13% average increase compared to the previous week, where 450,000 tests were conducted. Now, at this point, I would like to pause and say that the testing level is still low compared to what we expect. We expect to be the continent to be conducting at least 1 million tests or more a week. So that number, that increase of 13%, even though compared to last week, it still represents a low number of testing, especially now that we are seeing several countries beginning to report an increase in number of cases. In terms of vaccines, 790 million doses of vaccines have been received on the continent, of which 552 million doses have been administered, representing 70% of those vaccines that have been that are available, that have been used. But in terms of individuals that have received full immunization, that is at least 2 doses or 1 dose of the Johnson & Johnson, a total of 17.3% of the population has been fully vaccinated. A couple of countries have vaccinated more than 35% of their population, including Seychelles, Mauritius, Rwanda, Morocco, Botswana, Cape Verde, Tunisia, Mozambique, Sao Tome and Principe. It is important to note that as we begin to now use the 2022 population estimates provided by the United Nations Population Agency, some of these numbers will be adjusted and there might be slight decreases. Just to note that these numbers, the population was, the 2020 population was what has been used so far. So those adjustments will have to be made. So I think that is all for the briefing. Let me just say that, as Wayne said, this will be my last briefing with all of you. I just wanted to thank you all very sincerely for the strong collaboration and partnership that the Africa CDC and the African Union have enjoyed with the media. We have worked together for the last close to 2.5 years, sitting on this platform almost every week. And at the start of this pandemic, we're all frightened. We feared together. We worried together with all of you. But we were also very determined. We were united in determination that we had to fight this pandemic. And we could only have been successful through your very close partnership, because you are the interface between us, a public health agency, and the wider population. And I must say that I've been very proud to have been part of this forum every week, and thanks to the work that you all have done. I believe strongly that when the history of this pandemic will be written, the role that the media played in Africa in galvanizing the population, mobilizing the continent, will always be remembered. I'm very sure about that. I'm departing the Africa CDC with a lot of mixed feelings. One is that of really joy to see that for the past 5 years, we collectively, as a continent, in partnership with our close allies, have actually built a formidable Africa CDC, a public health agency that has become a respectable public health, a premier public health organization for the continent and for the world, and is contributing into the fight against COVID-19 and other global health security. But I also depart with knowing that there's remarkable challenges that still lie ahead of us. The pandemic is not yet over. The trajectory remains very uncertain and unpredictable, except we vaccinate to at least 70%. depart knowing that we have, as a continent, continue to fight several outbreaks, including Ebola, including cholera outbreaks, even measles outbreaks and others. So the challenge ahead it will be enormous to get Africa CDC to continue to support all member states of the African Union. But with the right determination, I'm very convinced that we are going to make it as a public health agency. Wayne, I'd really like to sincerely thank you for your efforts, your partnership, true partnership in this, the relationship between the Africa CDC and the Department of Information and Communication has been remarkable. I think it has revealed what Africa Union Commission can do if departments come together and focus on a common cause. And the common cause here was a threat that was existential in nature. And through a very strong collaboration and partnership with you sitting next to me every week, I mean, I must say, with rare exception, I think the world began to learn more about what the African Union is doing. So thank you so much, and transmit this to the leadership of DIC. Thank you.
I certainly will pass on that message. Thank you very much, John. And I just want to add a comment onto what you said about the role of the media, that they have done exceptionally well. And as we celebrated World Press Freedom Day last week, it was mentioned. And we were also very happy to pass on the message that at a time when the world seemingly came to a standstill, the media was there to transport and transmit these messages coming from these press briefings, and that the messages were life-saving. So thank you very much, Dr. John. We all wish you the very, very best. Okay, now let's go into our question and answer section. Let's start with Sarah Jerving, who is coming through live. Sarah, please go ahead.
I just wanted to thank you so much, Dr. Kangasong, and Win as well, for being so open with the press over the last 2 years and really working with us to have that crucial information to share the developments of the pandemic with the public. It really does feel like the end of an era. But I'm wondering if you might be able to share with us your vision for PEPFAR, what you think will change, and when you will start this new role. Thank you.
Thank you so much, Sarah. And I think that's a very important point, that the point made about our guiding principle of, as a young public health agency, was really to build trust with the public. And to build trust with the public, it required that we are transparent, especially during this pandemic. We told you what we knew when we knew it, and we also admitted that we didn't know what we didn't know. And as new information was gathered, we used that to enrich our common understanding and share that with you all. I think we've all learned and grown in this situation. So with respect to PEPFAR, now I can speak freely, now that I'm confirmed. HIV remains a pandemic. I just wrote a paper in the Lancet HIV where I characterize it as the juxtaposition of two pandemics, HIV and COVID-19. And as a continent, or let me rather start as a pandemic, where my history with PEPFAR started in 2003. At that time, I was working in Cote d'Ivoire as a mid-level public health expert. And we saw how HIV was destroying the continent in an amazing way. Today, thanks to the work of PEPFAR and others like the Global Fund, we are at a very different stage of this pandemic. The HIV pandemic, in this case, just to be sure that there's no confusion here, is still there with us. We are at a point where I would call it the tail of it. So the priority number one for me would be to work collaboratively so that we can achieve the goals agreed on by 2030, which is to control HIV, which we just have 8 years. I think that would be the number one priority. Focus the program on achieving that goal as much as possible. Get many countries across the world that PEPFAR is supporting to what you call epidemic control. That is the level where the level of new infections decrease constantly. So I think that is going to be number one priority. The second priority is really to be sure that we strengthen our partnerships with the countries that we support and learn lessons from the countries that we PEPFAR support. Understanding that, as I said, we are at the tail end of this pandemic, which means that the fight becomes harder. It becomes tougher to fight any disease when you are at that tail end of it. I think that is extremely important. Thirdly is sustainability. How do we sustain the efforts that the ongoing, the efforts that PEPFAR has, or the investments that PEPFAR have put in for the past close to 20 years. I think next year, PEPFAR will be celebrating the 20th anniversary. But how do we sustain that? By elevating HIV up to the platform of the same level as the understanding of head of states on the continent, so that they can at least square with the commitment that they took in 2001, when, if you remember, the Abuja Declaration, where they all committed to the fight against HIV, AIDS, and other diseases. Now we've seen that HIV, AIDS has not gone away. Here we are with another disease. Fourthly is to really make sure that there is no dichotomy between service delivery and system strengthening. We fully understand that strengthening health systems are meaningless if they do not support service delivery. And we also know that service delivery are not meaningful in terms of the rollout if there are no good systems. So we really have to make sure that that interface between strengthening health systems and self-services is really enforced. So I think, and a whole host of things that we are going to be looking at after consultation with people that have been continued to work in the program. So I hope that helps.
All right, thank you. Let's go to our online questions. And the first one is from Janice Q. And Janice wants you to comment on the process for your replacement.
So the leadership of the commission is the chairperson and the deputy chairperson are working very hard to go through a very transparent and competitive process for the selection of the next Director General of the Africa CDC. So a couple of things. The job description has been taken to the board, the governing board of Africa CDC, and they approve it. So that is one. The next step will be to advertise the position, open it up for competition. They will receive applications from the qualified candidates, and then the governing board will review that. Governing board is made of ministers of health, some commissioners, and then the private sector and civil society. So that governing board will review the candidates or the candidatures and then rank them through a competitive selection process, including an interview, and then submit the outcomes to the chairperson of the African Union Commission, who makes the final selection. So that is, in a nutshell, what will happen.
All right, thank you. Let's go back to our live questions and say hello to Paul Adepoju. Paul, please go ahead.
Hello, and let me also start by congratulating Dr. John through this process. It's really, really exciting to look at how your journey to this moment. And I just, let me just say personally, I want to appreciate your ability to make yourself available to journalists. And I would also like to challenge the Africa CDC to ensure that this avenue that we have to talk directly to the leadership does not close with his departure. So the question I have for you takes Sarah's question a little bit further. I remember watching your appearance before the Senate, and one of the questions that really came up was the issue of using U.S. resources. He promised not to use U.S. resources to support conversion. And one of the things that conversion therapy, and one of the things that is really at the limitations for the end of this HIV pandemic has always been the key populations, and especially in African countries where some of the key populations are actually outlawed. So looking at the current approach, what do you think you would like to do differently if you have the ability to really make some landmark changes at PEPFAR? And looking at what has been done so far, do you still think the 2030 target is within reach? And if I can chip in this last question, what do you think specifically prepares you for this new PEPFAR position? Thank you very much.
No, thank you, Paul, and really also a very personal thank you to you for all your the work that you do. I read all your work that you publish in Nature or Lancet and other outlets that I do follow that very closely. I really want to congratulate you for the quality of what you do and the professionalism that accompanies it. So I think that we know that without getting into the details of the job, because I haven't resumed. I'm in Addis Ababa now. When I get to Washington, of course, you expect that I'll do a thorough review of the whole program and then to understand where the gaps are. But let me just say this, permit me answer this very broadly, that we, as a strategy, we have to follow the virus, right? We have to use data, use evidence to find out where the virus is, tailor our strategy to focus on that. If the virus is, as we know, predominantly in certain segments of the population, then we have to engage, develop strategies to engage that population at several levels, at policy level, political level, community engagement, civil society, and use everything that we have at our disposition to make sure that we begin to fight that stigmatization. We cannot win the battle against HIV/AIDS with stigmatization. And we have to be very, very direct with that. We cannot win the battle against HIV/AIDS without knowing where the virus is. We cannot win the battle against HIV/AIDS without a clear understanding that the enemy is the virus and not people. So I think that is what that would be. I would champion that mantra as much as possible. Are we up to? Are we going to meet 2030 targets? We have to strive towards that. It's a goal that we've all agreed that by 2020 we should bring HIV/AIDS to control. It's a goal that I would strive to mobilize all the assets that will be made available to me to make sure that we contribute to that goal, that universal goal. What prepares me for this job? I think my 30 years experience in public health prepares me for the job. My 29 years of that experience has been in HIV/AIDS. Started working in HIV/AIDS in 1988. When PEPFAR was created in the early 2000s, I was there. So until 5 years ago, I think I was the co-chair of the lab technical work group for PEPFAR. So it's not a new program for me. So I think with all of that, but no one is ever prepared for such a gigantic job. You learn, you continue to learn from colleagues who have been working on the program intensely. You continue to learn from member states that we support. And we continue to learn from partner organizations. I think it is that learning institution or the spirit of a learning institution that I would deploy towards achieving our goals in PEPFAR.
Thank you very much, John. We have a contribution from Lindsay Chutel, who is with the New York Times. So Lindsay has two types of contributions. Let me start with the one where she passes on her best regards for your new post. She says, thank you for your stewardship and transparency throughout this pandemic and for patiently describing scientific details to us, the lay people. It is deeply appreciated. So that is coming from Lindsay. Then let's go to her contribution on the subject matter of COVID-19. She says, the Aspen vaccine manufacturing plant in South Africa says that it has received 0 orders for its Aspenovax vaccine, which is licensed from Johnson & Johnson and created specifically for the African market. This means that the plant may have to shut down in 6 weeks. The Africa CDC has consistently advocated to local manufacturing of vaccines. And so could you share some insights into why this once celebrated plant hasn't been able to really get off the ground? This is one question. Then Lindsay continues. Aspen says it has been overlooked by multilateral organizations that are responsible for procuring vaccines in Africa. Is this correct? And then she continues, following that, if the South African plant does indeed close, what does that mean for the vaccine manufacturing capacity on the continent for other vaccines?
So thank you so much for those kind words. And I would also let me just see what I said earlier, that the partnership and collaboration and very respectful partnership with the media in the last 2.5 years to me has been extraordinary, including the work that we've done with the New York Times. I've given several interviews with the New York Times and written several essays as well. So a couple of things. I mean, the situation in Aspen is very worrying. If you recall, at the heart of this pandemic, we all agree that, when I mean all, I mean the global health community and also just the world as a whole agree that vaccine manufacturing regionally, and not just in Africa, but in other parts of the world, was the way to go to guarantee our collective health security. I think that is, so vaccine security in Africa is definitely global health security, contributes to global health security. I just want to make that statement very, very clearly. So we, as a continent, the African Union, if you recall, convened a summit, a vaccine summit last April on the 14th and on the 12th and 13th of April, where 40,000 people gathered on that platform. A Zoom platform is the largest platform that I can recall that brought so many people, that large number of people. At the end of that, President Tshisekedi, who was the chair of the African Union at that time, launched the Partnership for African Vaccine Manufacturing and set a target of 60% vaccines to be produced in Africa by the year 2040. I just wanted to give that background before I address the question. Now, if Aspen, the only company that started producing vaccines, others have since started doing that in Egypt, as we heard yesterday, and I think Algeria. If those companies are not supported, and then the whole pronouncement and commitments that we all made at the height of this pandemic would really not have been translated into facts. So I think that is very important. And then our collective global health security will continue to be undermined. We've all lived through this challenge of inequity in vaccines access and distribution. We don't want to live through that again in future. And the COVID-19 pandemic is not over. We truly, as I said at the start of this briefing, the trajectory on the continent is still very uncertain, unpredictable. Something tells me that we'll need to boost us again next year and the year after, and until this virus is fully brought under control. So if the situation with Aspen is not addressed, then you ask yourself the question, what will become the fate of about 10 countries that have engaged in vaccine manufacturing in Africa, including Rwanda, Kenya, South Africa, Tunisia, Egypt, Morocco, Algeria, Nigeria, Senegal, Ghana, and I might be missing some. So I think this is a situation that we have this issue that we must deal with very squarely. I'm very pleased that the political leadership of the continent is taking this very seriously. Just yesterday, under the leadership of President Macky Sall, the African Union current chair, convened a bureau meeting where the topic of the discussion there was vaccine production and the market shaping in Africa. And I think the consensus is that efforts must be made to make sure that vaccine production in Africa is supported by ensuring that the vaccines that are made in Africa are purchased. are the multilaterals favoring or not supporting Aspen? I think that is a question that I would defer to maybe the Gavi or COVAX to maybe if you can pose that to them, so that they can explain from their standpoint what is the barrier in buying the vaccines that are produced from Aspen, because in any side of any story has two sides. I mean, it would be very helpful if they can help enrich the conversation from their standpoint. But we know that at least as of a few weeks ago, that I had a conversation with Aspen, orders had not been placed.
All right, thank you, John. I'm just waiting for colleagues to continue sending their questions through. In the meantime, let's go over what Africa did right. You've been in the forefront of this fight against COVID-19. What do you think are those elements that contributed to what we may, loosely call a success for Africa in terms of the numbers and the statistics and the impact of COVID-19 on the health of the African people?
I think Africa did several things right. The fact that the continent agreed to rally around a joint continental strategy very early on, a continental strategy that was underpinned by the need to cooperate, coordinate, collaborate, and communicate, was, in my view, it was one of the only continent that had a coordinated strategy. If you recall, when on the 15th of February, the first COVID cases were reported in Egypt. And 1 week later, the chairperson of the African Union Commission, Chairperson Moussa Faki, summoned a meeting of all ministers of health. At that time, only Egypt had cases there. I don't recall any part of the world that reacted that quickly. So those early, in any outbreaks, how you react, how quickly you react determines the trajectory, at least early on. If you also recall, countries like Zimbabwe, Zambia, Malawi went into shutdown where only about 2 cases were reported. Okay, and that helped to blunt the initial spread of the virus. The spirit of sharing response commodities, diagnostics, PPEs was also, something that the continent and workforce deployment of community healthcare workers. The Africa CDC deployed about 20,000 community healthcare workers. Roll out genomics. The pathogen genomic network is a collective of many institutions in Africa working collectively, including the labs in South Africa. Tulio's lab that the Omicron was dictated is part of that. Overall, there were 12 initiatives that were launched during this pandemic under the leadership of the African Union and Africa CDC. I would name some of them. AVAT, the African Vaccine Acquisition Task Team. When the continent was faced with a situation where they couldn't explain why they didn't have vaccines, they set up the AVAT, the African Vaccine Acquisition Task Team. When commodities were scarce, that is response commodities, they set up the African Medicine Supply Platform, AMSP, and anyone can Google and see that, amsp.africa. The Pathogen Genomic Network was established, the PACT initiative to increase testing. There were about 12 different initiatives that were set up. And I think my hope and wish is that, as Paul said earlier, that those initiatives and some of them are continue to be supported so that those same platforms could be used in fighting other diseases like HIV, tuberculosis, and malaria. So a lot of good things happened during this pandemic, which for me was truly an eye-opener. But let me just, as you point to that, share a reflection on what I thought from a philosophical standpoint, what I call the doctrine of fighting pandemics, as I've learned in this pandemic. The key 5 Ps, as I call it, of the doctrine is you have to know your pathogen. If you know the pathogen, what happens is that you develop diagnostics and vaccines very quickly. So if you did not know that, then you struggle. And that is what Africa faced, a big challenge that they faced. Countries that took advantage of the early understanding of the sequences, developed diagnostics, and now develop vaccines there. So that is the first P. The second P is knowing your population. Without a strong understanding of the population, even new innovations and new inventions that are developed don't go far. We saw that we continue to see the challenge vaccines, where people assume that because you have a vaccine, you can easily deploy that, but you have to really cooperate with the community and inform them, educate them, make them be part of it completely there. And that's why the media is also very, very important. Our third P is the policies. We learned in this pandemic that you have to customize policies. Okay, and we took guidelines, Africa CDC, we developed more than 50 policies that were easy to be understood, easy to be translated into countries' implementation. That is very important. That is what Africa CDC has done remarkably well. The fourth P is the politics. Bad politics hurts a pandemic response. Good politics helps a pandemic response, period. We saw in the case with Africa CDC how the political leadership and Africa CDC work very, very closely. Overall, as of yesterday, I had briefed the Bureau of the Head of States 20 times, including a briefing yesterday. So that, again, it counts on how Africa has coordinated its efforts. And lastly, the last P is the partnerships. You build the right partnerships, then you have a good chance that you can. Nothing of good, especially in the pandemic, is done in isolation. You have to build the right partnerships there. So that is the doctrine of 5P that I will learn from this pandemic as I move on to apply them to fighting and other pandemics.
All right. Thank you very much, John. We see that Paul Adepoju, your hand is still up, but do you have another question for us?
Yes. And so last week, my attention got drawn to a new trend within the global community regarding reducing medical waste and health interventions, health-focused organizations like the Africa CDC also making intentional efforts to also reduce their contributions to the carbon footprint and environmental damage. I would like to know whether the Africa CDC also has any intentional agenda towards initiatives that promote single use of stuff that will reduce medical waste burdens, and of course any environment-friendly and climate-friendly initiatives that the organization is also part of, especially within it, or encouraging its partners to also be part of. So we are not just looking at One Health initiative alone, but also reducing what the center is also doing and contributing. Thank you.
Oh, no, thanks, Paul. That's a very good question. We have not, as Africa CDC, focused deliberately on developing policies or interventions in the medical waste area. But as you soon see in a 5-year strategic plan that will be published shortly, there will be a need for Africa CDC to begin to broaden. So far, the last 5 years, we're focused on infectious diseases. You see that in the next 5 years, we'll begin to include non-communicable diseases, including environmental. So I think that is where some of those things will occur. Now, we have to be mindful that 5 years into its creation, Africa CDC is staffing up and continues to strengthen different departments. So we need to give it time so that it can at least settle with what it has already started and then take on new challenges. But that is a very vital area of work.
All right, thank you very much. Sarah, I see that your hand is up, but let me just give this opportunity to people coming in for the first time, and then we'll come back to you. So let me start by saying hello and good morning or good afternoon to Sophie Mukwena from the SABC. Sophie, please go ahead.
Thank you so much. Dr. Nkenkesong, you will be leaving this important organization on the continent at the time where we are still struggling with COVID-19. What is your message to member countries in general in terms of building capacity, in terms of resources geared to addressing health issues because if you don't do that, we saw what happened. The economy will also collapse. And then the second question, we see rising numbers in South Africa. What's your observation? And finally, your message to the nurses out there today on International Nurses Day.
So thank you, Sophie. My message to the continent, my departing message to the continent is that it has to embrace a new public health, that the continent has to embrace a new public health order to ensure its health security sovereignty. The continent must embrace a new public health order to secure its health security sovereignty. I repeat that because it's so fundamental to what I've observed in the last 5 years, and this pandemic has kind of reinforced that. When Africa CDC was launched, it was very evident, and we wrote a paper and published in Lancet Global Health where we called for a new public health order. That was in 2017. And I think everything we argued in that paper came, unfortunately, to happen. And what does that mean? There are 5 things that I would strongly leave the continent with to look at very carefully if they have to guarantee the health sovereignty of the continent. One is to invest in manufacturing of diagnostics, pharmaceutical, and vaccines. For over 40 years, Sophie, we have been, as a continent, has been conducting more than 100 million HIV tests, but none of that is produced in Africa. Okay, I repeat that. Over 40 years, every year the continent conducts about 100 million tests, no manufacturing in Africa. And that is also true for AIDS drugs. Okay, so I think we know that you cannot guarantee the health security of your people if you do not have diagnostics, vaccines, and therapeutics. The second thing we are proposing to the continent as I depart is that strengthen national institutions and continental institutions like the Africa CDC, the African Medicine Agency, and other national public health institutes like what you have in South Africa, the National Center for Communicable Diseases or Infectious Diseases in South Africa. I think those are kind of things that would better prepare the continent. The continent must also expand its public health workforce and adhere to that program that was submitted by President Ramaphosa to establish a public health task team, a public health workforce task team. That is so critical. Without an effective public health workforce, you don't have a chance to fight infectious diseases. As a continent today, I think the continent of Africa has only about 1,900 epidemiologists. The statistics suggest that for every 200,000 people, you need 1 epidemiologist. So that if you divide that by 1.2 billion people, it means you need 6,000. But the continent only has 1 point. So there's a gap right there of 4,000 to be filled in there. That the continent would need to have a conversation in that space. Fourthly, is engagement with the private sector. The private sector has been incredibly valuable during this the fight against this pandemic. Partnership with people like Mr. Strive Masiwa that you are aware of. I mean, it's thanks to his innovation that we are able to roll out AVAD, roll out AMSP. People like the president of the Afro-Exim Bank, Benedict Orama, people like Dr. Vera Songwe and others, I mean, that I would not be able to list here, were extremely valuable. So we have to be very deliberate to say that the health security of the continent cannot be guaranteed only by the public sector. We must reach out to the private sector. Lastly is what we call action-oriented partnership with our partners, the partners, the traditional partners that support the continent. So I think those are the kind of things that must be done to guarantee the health sovereignty, the health security sovereignty of the continent. Your last question about the numbers in South Africa. Again, South Africa has a very strong surveillance network, so they pick things very early. So some of the numbers that you are seeing there is a reflection of how good the surveillance system in South Africa is. And again, I remain confident that South Africa has the experience and expertise now to bend the curve. So this wave will come up. We don't know how high the peak will be, but I have no doubt that the country will mobilize and bring it down.
Thank you very much, John. We have a comment rather, from Judith Akolo, who is with the Kenya Broadcasting Corporation, after which she puts forward her question. So her comment is, I'm following on live stream and I'm wishing Dr. Nkengasong the very best. That's from Judith. Then she goes into her question. She says, my question is, now that everyone seems to think that the continent is safe from COVID-19, what happens to all the efforts that were aimed at combating the disease, like the vaccination drives?
No, let me just be very clear, and I hope I've been very consistent with this message, that we are not out of the wood yet. The continent is not out of the wood. COVID is there. We cannot confuse where there's a low transmission season, which is a trough, which the continent has enjoyed for the past 2 months with very low transmission, but now you see that the cases are coming back up. So it's this seasonality that you continue to see until the only way that this will be brought under control is by scaling up vaccination. So I think that is just, and the best time to vaccinate is, the vaccinated population is now, when we are facing a low transmission season there. So again, Judy, you're absolutely right. It just makes it harder for the population to accept this medical intervention. When I believe it was the third wave or so, when people were dying a lot, I mean, the demand for vaccines was very, very high. I mean, countries were calling us and requesting for vaccines. But when you see a low transmission season like what the continent has enjoyed for the last 2 months, you begin to see a decrease in the way countries ask for vaccines. But it is my appeal that this is the time to do 3 things. 1, increase testing. 2nd, increase surveillance. And thirdly, increase vaccination.
All right, thanks, John. Sarah Jerving, I come back to you. Please go ahead with your question.
Thank you so much. What outcomes do you hope come out of the Global COVID Summit today? Thank you.
First of all, let me just start off by really acknowledging and congratulating the leadership of President Biden. This is the 2nd summit. And that is the kind of leadership that I refer to when, if you remember, one of the P's I mentioned was political. There is good politics. That is very important for us to combat this pandemic. Now, I'm hoping that there will be a consensus that we need to focus a lot on increased vaccination. I'm hoping that so that and coordinated approach to vaccinating, including in Africa, under the leadership of the AU and Africa CDC. I'm hoping that the test and treat will be highlighted, that, as I said earlier, they need to test more, conduct surveillance, and people that are identified are put under a treatment quickly. I'm also hoping that there will be a commitment that vaccine manufacturing is an important, regional manufacturing is an important tool for our collective health security. And also, of course, that manufacturing of personal protective equipment is key, and access to them as well. So those are some of the things that I'm hoping that the summit will achieve.
All right, thank you, John. We are coming to the end of our 1 hour. So perhaps let me give you this opportunity one last time for you to give us the main highlights of the briefing today.
Well, my highlight today is just a thank you message to all of you. I mean, I'm just to repeat myself, starting by those in the studio here, including you, Wayne. It's been a remarkable journey for the last, I can't believe we are close to 2.5 years, but we are. This is May. So, and we've been doing this since January. So I think that has been a remarkable journey. My caution to the continent is that the pandemic is not over. It's far from over. We still don't know what variants will emerge. Vaccination to a scale to above 70% is key. But again, just to keep it short, is really to thank you all for the support, the encouragement, the partnership that we've all enjoyed from you all as an interface with the population. As when you rightly said, when none of us were moving around, only through your messages could we reach the population there. So I will be eternally indebted to this strong partnership and collaboration. And I hope that whoever is selected by the leadership of the African Union, you continue to support him or her in the same way that I was supported. Thank you.
All right, thank you very much. The last words from Dr. John Nkengasong, sitting in the studios here at the African Union Commission, as he'll now be proceeding to take up his new responsibilities with PEPFAR. So I think that I speak for everyone, that is including those who are in the studio, from the African Union, from the Africa CDC, and all those who are joining us online. And I see a strong contingent from the Africa CDC that has joined us, including the Deputy Director, Dr. Ahmed Ogwell, and Dr. Benjamin Judalbaye, and a lot of the other Africa CDC staff members who have tuned in for this final press briefing of Dr. John Nkengasong. Let me thank you again, colleagues, as usual, for your interest in continuing to cover the issues of COVID-19, and I assure you that we will continue to bring you more information from next week going forwards. But for now, it is as they say, we meet to part. To Dr. John, we meet to part, and hopefully it is parting to meet again at some other point. We wish you the very best of God's blessings for you and your family as you start your new job. So colleagues, join us again next week on Thursday at the same time for our briefings. Bye-bye for now.